The NHS Clinical Entrepreneur Programme is committed to tackling health inequalities and ensuring equality, diversity and inclusion. Health inequalities are avoidable, and we recognise the important role that the NHS Clinical Entrepreneur Programme must play in supporting the ambitions of the NHS Core 20+5. The programme is accessible to all NHS entrepreneurs and intrapreneurs and empowers them with the knowledge, tools and insights to be able to progress the development of innovation to positively impact on health inequalities.
My innovation addresses the health inequalities in maternity care as it stands today. Black people are 4 times more likely to die in the perinatal period. The reports and statistics were out there, and I could be that solution and make sure that my children will never be or face the same statistics as they are today.
CanSense is a diagnostic blood test that diagnoses bowel cancer at its very earliest stages. The benefits of it is that it can also detect pre-malignant change, so it can detect bowel polyps before they can even turn into cancers. So you can then give that patient a colonoscopy to remove the polyp, and you're looking at a cancer prevention tool then, not just an early cancer diagnostic tool.
We are a major trauma centre, and that means we get a lot of patients that come in as victims of injuries and violence. Now we're at the cutting edge of managing those injuries, making sure they're stable, making sure they're getting admitted in the care they need to recover. But what we struggle with is what are the causes that lead them into violence in the first place? That's why we've got an A&E Youth Navigator service. It's a fantastic initiative which allows youth workers to engage with some of these vulnerable young adults.
Once we get a referral, we'll go and see a young person either in A&E or on one of the wards. We carry out an assessment with them to see if there's any additional support that they might need.
It's a great opportunity to have our youth navigators engaging with these young people within the hospital setting, when sometimes they're at their most vulnerable, but actually they're also most willing to listen and engage with why they ended up in hospital in the first place.
I'm one of the founders of Health Pioneers charity, which helps young people from the most socioeconomic deprived areas and amongst ethnic minorities to help reduce health inequalities.
Developed a novel medical device that can diagnose cardiovascular diseases years before symptoms appear. In our feasibility trial, one of our healthy volunteers turned out to be unhealthy, so we told our volunteer to go get checked out in the NHS. 1 GP visit, cardiology visit, echocardiogram, MRI and CT scan, and 6 months later he had the same diagnosis that we gave him in 10 seconds with our very cheap device that can work up to 15 meters distance without the use of an expert.
My innovation brings essential screening and healthcare to asylum seekers in temporary accommodation and detention centres.
Because we are here for peace. We are here to build our life. If NHS help us to find our way, it is the best thing that they can do it for us as asylum seekers.
Earswitch has been designed to help people address their health inequalities by allowing people with severe neurodisabilities such as motor neuron disease, cerebral palsy and locked-in syndrome to communicate, all from in their earphones.